here with me physical therapist Clorissa Archie. Today is March 28th, 2018, and for consent purposes, is it fine if I record our conversation?
Absolutely, it's fine.
Okay, to give you a background about me, I am a student here in Florida. I attend Valencia College, and I believe you will be the best person for this interview because the years of your experience and all the great achievements that you have, and I am very intrigued about your passion for being a physical therapist.
Okay.
Being a physical therapist is my dream job, and I would like more insight about the perks and the cons of being a physical therapist.
Okay.
So I'm going to start off by asking you, like, what is your current job title and position, and how long have you been in this role?
So I want to first say that thank you for allowing me to be a part of your interview. I have been a physical therapist for about 10 years, and I enjoy what I do. One of the most important things that comes with being a physical therapist is that I have the ability to assist with patients in their rehabilitation process. I help prevent different symptoms from chronic pains, and I'm able to assist them with their illnesses and their injuries, whether it's in a clinic, it's in a hospital, their own private homes, or even a nursing home. So, that's what I do, and that's my job title is a physical therapist.
Nice. So how did you land this position? How did you know that you wanted to become a physical therapist?
So I learned that I wanted to become a physical therapist when I witnessed my grandparents struggle through the different challenges of making it through a time when they were injured. Like, for instance, a story that I always tell, even some of my patients, how my grandfather, he went through a stroke, and because of financial disadvantages, he didn't have the opportunity to do proper physical therapy. So him and his wife had to go through the different struggles of trying to teach himself how to, talk again, walk again, and it was very hard to get through those different mental barriers. And so I said to myself at that moment that I wanted to be in a better position to help those that can't necessarily afford a physical therapist within my own family. And so that's where I discovered I wanted to be a medical assistant. A medical assistant.
Nice. So do you have any special degrees and certificates?
Yes. So I had to, going through school, I had to obtain, it was so long ago. I had to obtain a national physical therapist examination. I had to go through that process in order to become a physical therapist. I also had to take a law exam, and it was required for them to do a criminal background check as well. And those were just a few of the things that I had to do in order to practice.
Okay, so how long were you in school? And if you could give me an estimate cost of becoming a physical therapist, what would that number be?
So I went to undergrad school for 4 years, and with doing my labs and externship, I would say a total of at least 6 years. Wow. And I know that's a long time. And so it cost me a whole lot of money. I would say at least about $55,000 in total. Yeah, that's a pretty nice penny.
Pretty penny.
Yeah.
So did you have a major in college?
Yes, my major was physical therapy. However, at the time they didn't have an actual program for physical therapy, so I had to major in psychology with a minor in exercise science. And so at the time, that's what I had to major in. But now I believe you guys have opportunities where you actually have different programs that
we do
tailor you straight to physical therapy, which is awesome. Yeah.
So what do you enjoy most? And like, do you have any challenges that come with being a physical therapist?
Yes.
Like, do you have time to spend with your family? Like, are you working part-time or full-time? Like, what's the perks on just the community?
Okay. So I currently work in a nursing / residential care facility, and it's normally like an 8 to 5, but there are times, where I have to work evenings or maybe even the weekends, and sometimes that takes a piece of time from my family. But essentially, I work 8 to 5, so I wanted to pick a career that would definitely allow me to be with my family.
Nice. So do you work as a team or are you independently working?
So I currently work with a team, and they are my support system at work. We all work together. We demonstrate teamwork daily with each and every one of our patients, and it's a great help. It's a great help.
Okay, so you mentioned your team and that y'all get together along very well. So, like, the environment do have an impact on your work. So, can you explain it to me?
Absolutely. Working with a team that demonstrates teamwork will definitely help you thrive better in treating your patients. Just in case you're not there, or you're with another patient because it's taking a little longer for you to assist one patient over the other. You have people there to help you assist and treat your patient just as if it was their own.
So what advice would you give me to keep in mind along the way as I'm pursuing my career as a physical therapist?
Oh, wow. Definitely be compassionate with your patients. Be compassionate with people. Exercise that daily. Definitely want to make sure that you work on your time management skills. It's always going to be necessary because I'm sure you will have a large workflow, based off of, the different times that's coming up, and make sure that you're resourceful and keep up your physical stamina, definitely. So those are some things that you should definitely just keep an eye on, work hard towards, and you'll be a great physical therapist.
So what do you live by? Like, what keeps you motivated to continue to go to work and keep that compassion and that stamina to keep you going?
So the most important thing that keeps me going is to make sure that this is what you want to do. Be clear on what you're driven to do for people. If you're driven to care for people, and this is the way that you want to care for people and treating them with their illnesses, with their injuries, rebuilding people's mind and mechanics of their brain and their bodies, then this is the job for you. So stay clear with how you want to treat people.
Okay, thank you. Thank you for your time.
Absolutely.
I really appreciate it. Thank you.
Thank you so much. It was a pleasure.
Have a good one.
You do the same. Thank you.
Good evening. This is